Could you take your shirt off for me? Alright, so whenever we're trying to break up some of this muscle tightness and soreness, we can use Graston, where we're going to slap down a bunch of cocoa butter so we're gliding over the top of the skin nice and easy. And we're using this to break up the fascial adhesions and scar tissue that form over time. So as we get going, so our ridge of our scapula, spinal scapula is right there, where we get a bunch of muscle tendon insertion. Keep me comfortably tolerable on a scale of 0 to 10, that's a 3 or a 4. If I get above that, say 5 or 6, and I'll lighten up.
Okay.
Just work on the medial border too, where we're going to get a bunch of that rhomboid injury with chronic shoulders up by your ears, the upper cross syndrome or 6 scapula. Can I have you look down and to the right? So change that angle. Still comfortably tolerable?
Oh, yeah.
Doing okay?
Yep.
How's that guy?
What's that?
Is that a little tender, or am I okay?
No, you're all right. Yep.
Still good?
Yep.
So get a little more leverage on there by using a different hand grip to slide and scoop. How's the scoop?
Good.
A little more intense?
It is.
Can I have you take your right hand and put it on the top of your head, and as you keep looking right, look to the right, other right, and pull down. Yeah, and you pull down, and can I have you sit on this hand, sit on it, palm up, and then as you lean away, giving her a good stretch, I get to get more tension on this guy. Too much?
No, that's good.
So we can see that dark red petechiae forming. We got a good little spot right there that's turning bright red, fast and furious. And that whole, follow that middle trap cutting over right to the spine, which is part of our stick point. And the harder he pulls, the more tension I get, and the more shearing force I get to get more destruction or therapeutic healing, depending who is reading my notes.